Life Wisdom.
Hi, I'm Dr. Colin Ross. I'm a psychiatrist based in Dallas. I moved from Canada to Dallas in 1991. And what I want to talk about today is mental health and gun control, which is a pretty hot topic with a lot of very hot feelings on this side and that side. And my perspective on it is basically mental health and gun control should have nothing to do with each other. When we're talking about mass shooters, mass violence, school shooters, we shouldn't have any legislation, any laws, any discrimination that has anything to do with mental health whatsoever. So why do I think that? Well, on the other hand, it's clear that many of the shooters are pretty disturbed individuals. So there's no doubt about that. And if we look at the Aurora, Colorado shooter, James Holmes, obviously seriously mentally disturbed. And the guy who shot Gabby Gifford and the other people in Arizona, clearly highly mentally disturbed individuals. So I'm not saying that shooters aren't mentally disturbed. What's the basis of my opinion? Well, first of all, let's take a look at, if we're looking at serious major mental illness, like schizophrenia and related disorders, schizophrenia ballparkish will affect about 1% of people in the United States in the course of their lives. So just again, ballpark figures, we could say about 3.5 million people in the United States will develop schizophrenia at some point in their lives. And most people, the schizophrenia is already up and operating in their 20s. You don't usually develop schizophrenia for the first time at 40. And most shooters tend to be under 30 years old. So most of the people who are going to develop schizophrenia already have it when they're in the age range that people become shooters. But still, that's 3.5 million people in the United States. So if we look through all the shooting incidents for the past few decades, most of them are the kind of the Columbine style shooters. They're young people, they're disaffected, they may be nerds, they may be goths, they're being harassed by the jocks and so on. They're kind of misfit type people, but they're not actively hallucinating, psychotic. They don't have diagnoses like schizophrenia. So it's really the only ones that come to top of my mind are Aurora, Colorado and Tucson, Arizona. Those two shooters clearly are somewhere in the general ballpark of schizophrenia based on what we know in the public domain. So that means in the last 20, 30, 40 years, we're looking at literally just a handful of people with major mental illness who've become shooters. So there's out of 3.5 million people, we're going to try and identify 2 or 3 or 4 or 5 who are going to become shooters. Obviously totally impossible. So since it's totally impossible in advance to identify out of all the people with schizophrenia who are the ones who are going to become shooters, what's the point of having any legislation or rules or screening? It's impossible. You never in fact will catch them. So the next reason I'm not in favor of any such legislation is when you look at the data in the psychiatry research and the official position of the American Psychiatric Association, it always boils down to people with serious mental illnesses are victims of homicide and victims of violence more often than average, but they don't actually perpetrate crimes of violence either at all more often than average or just maybe a little bit. So having a serious major mental illness doesn't mean your odds of being a mass shooter are higher than just being a regular citizen. So therefore, why are we talking about screening this sector of the population? And imagine the public uproar if there's some legislation that's being voted on and the legislators are saying, well, black people tend to be gangbangers, so we're going to screen all the black people and it's going to be a lot more difficult to get a gun if you're black. I mean, it'd be total outrage. But if we take another sector of the population, people with mental illness, all of a sudden it's kind of more politically correct to discriminate against them because they're scary and dangerous. But actually, in fact, the data show that they're not more scary and dangerous than the average person. So why discriminate against them or profile them or screen them or put a barrier in the way of their getting guns? And clearly the majority of criminals are not psychotic, they're just well-organized criminal people. So when we're trying to have any kind of screening, any kind of documentation, any kind of hurdle in the way of getting a gun, the talk is always about criminals and bad people. But criminals aren't psychotic, mentally ill. They have to be organized enough to be criminals. So again, it makes no sense to discriminate against the mentally ill people. And then the next reason I'm against it is, let's take a look at how effective treatment is. James Holmes, the Aurora, Colorado shooter, was already seeing a psychiatrist. So how much did the psychiatrist prevent that from happening? The guy who shot Chris Kyle, the American sniper, he had PTSD, not a major mental illness. But he had previously been involuntarily committed to a hospital in Dallas, not far from my office, because he was threatened to kill himself and family members. And this was within 6 months of him shooting Chris Kyle. So we already knew that this guy had a mental disorder. He was in a mental hospital. We already knew he was threatening to kill people, and still we discharged him and didn't prevent it. So psychiatry just doesn't have the ability to identify people who are going to become violent, even when they have them in treatment, and do anything about it. There's no data or evidence that that's possible. Plus, if you look at the treatment outcome studies for schizophrenia, the big one's called the CATIE trial, C-A-T-I-E, which is short for the big long name of the study. And this is a study where around about 1,500 people were recruited from many, many different centers who met criteria for schizophrenia, and they were put on a medication, and if they didn't respond, they could be switched to another one, or another one could be added. Very well-designed $24 million grant from NIMH. A year and a half later, 3/4 of people had dropped out due to the meds not working or side effects. And in the publications, it doesn't state exactly how many people responded by their scores dropping substantially. But if you go to other studies, the response rate is around about 30%. If you have schizophrenia and you're highly psychotic, response means your score drops by 40% or more on a measure of psychosis. Only about 30% of people have that response where their score drops 40% or more. So not only can we never find the needle in the haystack of the handful of people out of millions who are going to become shooters, even when we do find them, we have 2 examples where being in treatment with a psychiatrist didn't prevent a shooting. And we know from the research data that most people are going to drop out, and only in the ballpark of 7, 8, 10% of people a year and a half later will still be in treatment and have responded to the meds. So why would we discriminate against all the other members of that category who we can't identify in advance, who won't participate in treatment, who will drop out of treatment even if we have our hands on them? So you're just basically taking away the civil rights of a group of people based on discrimination against that category. We're taking away those civil rights has no possibility whatsoever of reducing gun violence. So it won't work because you can't identify those people. It won't work because even if you do identify them, we don't have a treatment that we know is going to prevent them from becoming mass shooters. And so you're just taking away the civil rights of a group of people for no benefit to society as a whole. Therefore, I think that although it's clear that people who go out and shoot school children obviously are disturbed, having legislation about that or special procedures or discrimination is not going to solve the problem and is just going to discriminate against this group. And then on top of it, if you just look at it from the point of view of psychiatry and psychiatrists, if psychiatrists allow themselves to be put in the position of, we're going to be the agents of the state, identifying people and treating them, incarcerating them, preventing them from having guns, monitoring them more closely, we're now agents of the state. So that's what was going on in Russia, where the psychiatry became co-opted to become an agent of the state. And the other side of it is then take a look at the liability that psychiatry is taking on. Because if psychiatry claims that it can identify these people and do something about them, anytime it fails to do that, there's going to be this massive liability. So it's not even in the interest of the profession. So that's the sum of my reasons why I think mental health legislation, gun control should be totally separate topics. Thanks for listening.